This is a Jet 24, Funk 66, your Erie.com special report.
Good afternoon. We interrupt our programming to bring you a special report and update on the spread of COVID-19 in Erie County and also where the county stands in terms of vaccinations. This coming as the U.S. Is increasing in cases. Let's go now live to the studios of WQLN TV, where Erie County Executive Kathy Dahlkemper is standing by for her weekly update on COVID-19 in Erie County.
On COVID-19, the pandemic here in Erie County. We have 121 new cases to report in Erie County as of late last evening, which brings us to a total of 15,106 cumulative positive cases since March of 2020, and a total of 365 deaths reported in the NEDS system. The positivity rate for Erie County was at 11.9%. for the week of January 15th through the 21st, according to the Pennsylvania Department of Health. And as of this morning, there are 56 total COVID-19 hospitalizations, with 7 people on ventilators within the hospitals of Erie County. Questions, of course, continue to roll in about the COVID-19 vaccine, and we can only continue to ask everyone who wishes to get that vaccine to have patience. While we're very glad that the Biden administration is aiming to ramp up the vaccine allocation and distribution to states, Pennsylvania needs millions of vaccine doses and currently is only getting approximately 143,000 doses per week. In the meantime, and even if you have received the vaccine, 1 or 2 of the doses, it's truly important that you continue to follow the guidance and the mitigation efforts that we've been talking about. The protocols of wearing a mask that covers both your nose and your mouth when you go outside near anyone who doesn't live inside your home. Always keeping that 6-foot distance from others who don't live with you. Staying home as much as possible and away from any kind of crowd. And definitely when you feel ill, stay home, monitor yourself, get a test if your symptoms continue, truly limiting your exposure to anyone else. As a reminder, you can find a document of frequently asked questions about the vaccine at eriecountypa.gov, along with all the other great resources there regarding the pandemic. You can also visit the vaccine page at health.pa.gov for more information, including a map that shows where vaccines, either currently or in the near future, will be given. If you don't have access to the internet, you can call 877-724-3258. That's 877-724-3258. That will give you more information about when and where to get a vaccine within the Commonwealth. And with that, I'm pleased to have with me today Charlotte Behringer, the Director of Community Health Services at the Erie County Department of Health, and she will share updates from the Health Department. Char?
Thank you very much. As we are all aware, impression for some that the pandemic will soon be over because vaccines are available. Really not likely, I'm sorry to say. Long-term tool.
She's not going to be able to go. Her audio is not going to work.
Char's audio is not working?
It's like double.
I'm hearing an echo. Char, for some reason we're hearing an echo from your audio, so maybe she could dial back in. And in the meantime, I'm going to go to our second guest, who is Dr. Anthony Snow. He is the Medical Director at the Erie County Department of Health, and he's going to also share an update on particularly our testing sites within the community. Dr. Snow?
Thank you very much. It's a pleasure to be here. I am so glad that we're emphasizing in a world that's kind of dominated by vaccines, the importance of testing. Vaccines are months to a year or more in their true penetration, but we have people today who have COVID and need treatment, and that's where testing comes into the picture. There's a list of testing sites that are available.
Nobody's going to, I guess we're having problems on technology with everyone, and I'm sure you've all heard the echo, as I can hear it here in the studio from our guests today, unfortunately. I do know that Dr. Snow is going to talk about the fact that both Shar and Dr. Snow are going to talk about the fact that testing is so important with all of the focus we've had on vaccine. Okay, I guess we have our technical issues taken care of. We're going to try to go back to Shar Behringer from the Erie County Department of Health. Shar?
I'm not hearing.
Okay, I think we're going to have to go to questions from the media, and hopefully our guests are with us, and maybe if there's a potential that they've got things fixed, they could come on and answer questions if need be. So I'm going to turn to the media now, and we're going to start with Talk Erie. Joel.
Thank you, County Executive. Can you hear me okay?
I can hear you fine. Could you hear that echo on your end?
Oh, it was crazy, yeah. Okay. Sorry about that.
I'm sorry about that, so go ahead.
The question is directly from a Talk Erie listener. If vaccine supply was no problem, do you know how many shots in Erie County? Is Erie County ready to deliver every day? And, who ultimately is in charge of vaccine distribution here in Erie County?
So there is no specific entity that is in charge of the vaccine that's local. The state really is running this vaccine effort across the Commonwealth. Any vaccine provider needs to be approved by the state, and then they order their vaccines directly from the state. So the state gets their allocation on a weekly basis. The providers, right now we know that, for example, Allegheny Health Network, St. Vincent, UPMC Hammett, Mill Creek Community Hospital, a few of our drugstores in the area, and soon to be more of those, as well as Community Health Net, are the main providers of the vaccine. They order their vaccine, and that vaccine then comes into them. But again, you might order a specific amount, and you may get less than that depending on what's available to the state. So it truly is the state who is controlling the vaccine at this point. Now, the other part of your question was about...
the first part of my question of how many, do you have a handle on how many, if we had the supply, how many shots in the arm could we achieve in Erie County?
Well, we are working on and have, it's coming together, a robust plan to actually run vaccination clinics, which would be, like we've seen maybe in some other places in the country where there would be a large facility, people would make appointments, people would come in there, get their vaccine, and then the hope would be that eventually also your PCP, your family doctor, could also administer the vaccine, but that's a little bit further out. So I don't have a number for you right now, Joel, but I can tell you that we are working diligently to make sure that large numbers of people can be vaccinated once that vaccine is available in those larger quantities.
Thank you.
Sure. Jet TV.
Hi, County Executive. This is Brian Wilk. January was the deadliest month in the United States for COVID-19. Is Erie County along the same tracks? Are we seeing that trend here as well?
We certainly are. Back in early November, we only had approximately 50 deaths. We now have 365. So we have had 300 plus deaths happen in the last 2 months, but many of those deaths have come to us in January, and I don't have that exact figure of January versus December, but I do know those 300 deaths have come just in these last couple months. Thank you, Brian.
Thank you.
Erie Times News. David?
Yes, Kathy. For county employees, could you tell me what departments the employees have been vaccinated for COVID-19, especially with the courthouse starting to open up a little bit more and more? And what is the timetable for other county employees? What other departments are getting vaccinated?
So there are 2 departments that have had, I would say, more extensive vaccination, and that would be corrections. That was the corrections officers, and the Office of Children and Youth through the DHS, Department of Human Services, mostly social workers and those who are having that direct contact, with the public, as well as some others in those departments. But we are also, and I know that some of the nurses at the health department, I don't remember exactly how many, have also received their vaccination. We have asked all of our directors from every department to find out which of their employees would want to be vaccinated, and then prioritizing those who have the greatest exposure as more vaccine becomes available. And later this week, we will be doing more vaccination of health department personnel, the ones who particularly have very much of an community contact. For example, beyond our nurses, our environmental staff who are out doing inspections on a regular basis.
Is there any kind of ballpark figure on number of people, would you say?
The number of people who have been vaccinated so far? Is that what your question?
Yes, please.
Is that what your question is?
Yeah, please. Roughly, how many? Is it dozens? Is it?
I would say about 200. But
okay.
Don't hold me to that number. I'd have to get better figures, and we can certainly get that for you. I think if you would like, we can get you the numbers.
All right. Thank you, Kathy.
Sure. Erie News Now.
Hi, good afternoon. We had a caller from the medical research call in again about possible vaccination sites. Any word on if indeed the Medical Reserve Corps would be involved in those, and any clue when those might be put in place, or does it just depend on vaccine allocation?
The first part of your question, I'm sorry, it was a little bit muffled, and so could you please repeat it?
Sorry about that. We had a caller from the Medical Reserve Corps call in saying that he had been notified about a possibility of mass vaccination clinics and the possible involvement of the Medical Reserve Corps. Any details on when those might be put into place, and or is it just a vaccine allocation deal?
That is completely dependent on the vaccine allocation. Currently, we are not getting enough vaccine into Erie County to have any kind of a mass vaccination clinic, but the Medical Reserve Corps certainly will be, I know they've already been informed that these will be coming, but we are awaiting greater allocations to Erie County than we currently have. All right, and we'll go back to Talk Erie.
Yes, hi. This is a question for you, County Executive. In light of the latest More Research COVID-19 survey, can you talk about your communication strategy to combat the resistance to the vaccine? More Research had it about 50% as all might want to get this vaccine. So it seems to be people in younger demographics and lower income brackets are more hesitant to get the vaccine.
Well, one of the things today is we have Dr. Tony Snow in the background, but I'm not sure if we've gotten the technical issues worked out. But I just got word that that may have been worked out. So if you're good with this right now, Joel, I'd like to ask Dr. Snow to speak because he's going to speak to some of this. Dr. Snow?
Sure. Yes, thank you very much. That's an excellent question because you're right. Supply and demand, supply, as you've heard, is a difficulty for us, but demand is what you're talking about. And they say about 50% are willing, 25% absolutely not, and 25% undecided. And we know to be effective, we need 80% or more of us to get the vaccine. So we have community health workers who are very knowledgeable in COVID-19, and they are canvassing the community to try to give truth and education to the many rumors that are out there about the vaccine that are keeping people afraid to get it. We also know there are cultural reasons that people don't want it, and there are reasons of suspicion of the whole medical industry. So we're working on that by getting the word out to people that people trust, by coming through all the media sources, by doing person-to-person training, try to break down the misconceptions and have people willing to accept that this is a vaccine like all vaccines, and it can make a difference in their health to protect themselves, their loved ones, their friends, and their neighbors.
Dr. Snow, just a follow-up. What about those that are having trouble with the vaccine on a political persuasion, if you will? Again, that came out of the survey as well, that more Democrats would be prone to have the vaccine than Republicans.
Well, unfortunately, you've hit upon one of the problems in this country. We've made a political issue out of a public health issue. And therefore, there's so much misinformation out there that it's really scuttling our ability to take a unified approach. We know that even before vaccines, countries have been successful when they did it in a united way. Well, we are not approaching this public health issue in a united way, forgetting that COVID kills more people a day than our number one and number two health killers, which are heart disease and cancer. But we still haven't a unified, as you brought up from your political point, but there's all kinds of angles causing people to fraction into little groups instead of a unified approach to this public health issue.
Thank you, sir.
Thank you. Jet TV. And I think Shar is probably back with us also, so if anyone has any questions for Shar or Dr. Snow.
County executive, we reported last week that St. Vincent had to stop scheduling new vaccinations until they get more supply. Do you know where they stand, or any other area hospitals as far as supplies?
I'm going to see if Shar is with us. She may have some better information on this. Shar, are you with us?
I am back with you. I do not have any additional information on vaccine supply to the hospitals. I know that St. Vincent set up clinics anticipating vaccine, but then did not receive the allocation that they had requested, did not receive all of it. Thus, they had to cancel some appointments.
Okay, thank you, Brian. Erie Times News, David?
Yes, Kathy. So with the CDC announcing yesterday about that they recommended that schools could reopen with certain safeguards and saying that indoor sports does pose a problem, have there been any discussions, I don't know, with the intermediate unit or with schools in particular about opening to a greater degree or perhaps reducing the indoor sports?
So we have a team, as you know, I brought this up before, who's been working directly with our school districts. In Pennsylvania, you know, we are a commonwealth and we are very parochial in how we run all of our different government entities. And each school district is its own government entity and will make their own decisions accordingly. And we can give them recommendations and we can give them support, which we have continued to do. What we have seen in the school districts that have had to go to remote because of outbreaks, oftentimes the outbreaks are related to the sports and not so much the actual sporting event or maybe not even the actual practice. But what we're finding is people carpooling, teams getting in a bus together, again, close proximity with people that you don't live with. And that's something that I hope that all people watching and listening think about as you're transporting your children or asking someone else to transport your children to a sporting event or practice that you might want them to participate in. But again, we give them advice, we give them as much guidance as we can, but it will be up to the school districts to decide how they go forward.
And have the outbreaks for the winter sports been worse than those for the fall sports for Erie County?
I'm not sure that the outbreaks have been any worse, but it just continues to be an ongoing source of spreading of the virus. You know, we've asked people to, of course, wear masks all the time in gyms, and when they are actually working out and when they're actually doing their activity. And we ask that of the sports teams too, but I think there's some leeway around that, and not everyone maybe is following that. But I would say more than that, it's happening maybe when they're in a car together and maybe they're not wearing masks. I don't know for sure, but again, it just seems like we have to be extra cautious when you're in those kind of close proximity situations, such as transportation. And I don't know if Shar has anything further on the sports piece that she may have learned through the environmental team at the health department. So I'll ask Shar if she has any more information on the schools.
Well, interestingly, study did address schools. It addressed schools actually before there was this huge surge back in November. That article did also say that the higher the incidence of disease, the more transmission there was in schools. We are certainly still in a high incidence transmission area in Erie County right now. Sports that are currently challenging for schools are particularly wrestling and swimming. These are sports that a mask really cannot be worn and has resulted in some disease spread.
Thank you, Shar. Erie News Now.
Hi, a question for you, County Executive, about the Erie County CARES Act money. The online dashboard shows that you still have $6 million remaining, which I would assume would have had to go back to the state at the stroke of midnight on New Year's. So is the online dashboard just behind, or was money not allocated? Can you bring me up to speed on where the money went?
I'm sorry, you were a little bit muffled again. I'm not sure what's...
Alrighty. The Erie County CARES Act money. Mm-hmm. The online dashboard shows that we still had $6 million unused in Erie County. Is that just behind, or was money not used? Can you bring me up to speed on where money went?
The balance is zero. All the money was used. The dashboard obviously needs to be updated. I'll make sure that the staff gets on that and updates that, because everything has been accounted for, so there was no money returned back to the federal government or the state from CARES.
And you happen to know roughly where that last $6 million went, or at least where the bulk of it went?
Gosh, it's been about a month since I've thought about that, because obviously the money had to be used by the end of December. And as we got towards the end, I know a couple of the big projects that were outstanding that were getting done right kind of up to the deadline were broadband connections. So VelocityNet had gotten a couple contracts to do work in Northeast, in Summit, in the city of Erie, particularly at the senior housing facilities. And so I know those projects were getting finished up. And so that, I know, was a big chunk of that. But it wasn't the whole $6 million, of course. And I would have to really go back and look at what on the dashboard is not updated to give you the exact accounting for that $6 million. But I will make sure that we get that updated, and certainly if you need any further detail, we can give you that even separately from the dashboard.
Thanks, I appreciate it.
Mm-hmm. And we'll go back to Talk Erie. We'll go back to Joel.
Yes, here's a question for Dr. Snow. Dr. Snow, when you're in a non-clinical context, are you wearing 2 masks these days, and what do you suggest to the general public?
I go along with it. I do not wear 2 masks as a rule, and I do wear a mask all the time when I'm not in my home. When I'm not, and of course in our clinical area, we have masks and shields when we see patients. But I'm a big believer in the desire that all of us would wear a mask when we go out of our house to protect ourselves, to protect others. And if we did that consistently, we could have a serious impact on the transmission of the COVID virus.
So are you saying that if you could just get people to wear the mask the right way or wear a mask at all, the 2 mask thing isn't necessary?
No, I'm not saying that, because they have said now with the double masking that it has some additional benefits. But compared to not wearing a mask at all, just wearing a mask, and particularly if all of us would do it, we'd be back into the successes of countries early in this pandemic who showed great benefit, and they were doing it basically because they had almost 100% of the people wearing a single mask, but it was still effective. And then when you combine it with the hand washing, with the distancing, with the willingness to avoid crowds, you can really have an impact, and none of that requires a vaccine. It's all better as we get a vaccine which says less places for the virus to go. But while the virus is with us now, that's where mask, washing, distancing, and avoiding crowds comes in.
Thank you, sir.
Yes, sir. Thank you for your question.
Thank you. Back to Brian, Jet TV.
County Executive, what political muscle can you use to get Erie County more vaccines faster? And is there any political capital that you can use to move this any faster?
Unfortunately, there is no political capital that I or anyone else can use. The state gets their allocation from the federal government. The federal government is trying to increase the amount of vaccine available to it to push down to the state and then eventually to the local. Unfortunately, a lot of effort was fortunately, a lot of effort was put into getting the vaccines actually to market, to get them, through the testing, and money was certainly expended to do that, and that's a huge feat. But there wasn't enough effort to think beyond having the vaccine into actual vaccination, to make sure that we had adequate quantity of the vaccine, and then how do we distribute it? How is it best put out there to get it into people's arms? And that's what the Biden administration is now dealing with. 1 week into being in office, that administration is working diligently to try to get more supply and to find a way to get that supply then out as quickly and most efficiently to the communities. So I could yell all day, I could make calls all day, but it wouldn't make a difference because there's no vaccine to be had beyond really what we get here in Erie County. And there is some really good websites, CDC, the Pennsylvania Department of Health. You can look at the vaccine, you can look where it's going, how much has gone out in general, how much has gone to each state. You can even drill down to the counties, and you can see that we're pretty much on par with just about everybody else in terms of the percentage of vaccine that we've gotten. It may be a little bit less, it may be a little bit more, but it's not in any way out of whack with our neighbors, both within the Commonwealth and through other states.
County Executive, have you gotten the vaccine?
I have not, and I will not get the vaccine until those who are in front of me in priority have the vaccine. I am 63 years old. I am healthy. I don't have any serious pre-existing conditions. So I actually would be in phase 2, but I guess because I'm a government official, I might be in phase 1C. But even then, there's many, many more people who I would consider to be a higher priority than myself. So I will wait to get the vaccine until it is my turn to get it. Although I would love to have it today, just as many who are listening and watching would love to have it. So I'm not afraid to get it. I'm anxious to get it, but I'm going to wait my turn to get it.
Thank you.
Erie Times News.
Yes, Kathy, I'm on the website where the vaccine distribution is for the hospitals and other healthcare organizations in Erie County. They've just updated it. And good news, the county health department was slated today or will today get 1,000 doses. I just wanted to ask Shar, I know the first 300 doses the health department got went toward the women's religious for their nursing home sisters that are in their facilities. Where are these 1,000 doses going to go that the health department's receiving this week?
Shar?
My understanding is that they will be coordinated with LECOM, who is working with us on our community campaign. I do not know what specific groups they are targeted for. I'm not working on a regular basis with the vaccine group.
I can answer some of that question if you'd like, David, because we had a meeting about this earlier today. That vaccine is going to still some personal care homes that have not received the vaccine yet, to some unaffiliated healthcare workers. So again, those who are not affiliated with one of our big systems and haven't been able to get the vaccine yet. So truly staying in that 1A area. That's most of those are going, I think all of them. And then, as I said, there will be some vaccination for specific positions within the health department who have very much a forward-facing position and are most at risk.
Okay, so it'll go toward the groups that you just mentioned, Kathy, and then also some of the vaccine will go toward the community vaccination clinics that LECOM Center on Health and Aging is going to do down the road?
No,
do I have that?
I don't believe any will be going to community this week. I think all that vaccine is going to those in the 1A, original 1A, I guess, because 1A is expanded, but to pretty much those who are on the front lines of healthcare, those who live in congregate settings, who have not gotten the vaccine yet, and then, as I said, some to the health department officials who are frontline, and I believe also some of those who work in funeral homes too, some funeral home individuals who are also considered to be high risk.
Okay, thank you.
Sure. Erie News Now.
Hi, a question for Dr. Snow. Doctor, as we continue to get especially more nursing home residents vaccinated, how quickly do you think we'll start seeing that have an effect on death and hospitalization rates, if you think it'll have one?
Dr. Snow?
That's a great question. You know, I'm not sure exactly of the penetration because it depends on the amount of folks who are being hospitalized from nursing homes. However, we know vaccines in time, and that's sort of closed settings. So as more and more of their folks are vaccinated, they will see less and less active infection, which then will lead to less and less complications, which include the hospitalizations and unfortunately the fatalities. So it will have an impact. It takes time though, and that's only a portion, even though it was a large portion initially of the folks who are hospitalized. And as long as the community is still experiencing outbursts of the COVID virus, we're still at risk of filling up our hospitals and our ICUs from the community access of the virus until the community starts putting a lid on the virus transmission. It will positively affect it, but the proportion may not be the impact you see because of community factors.
I think one point, too, that I'd like to bring forward that we haven't talked about yet today is the fact that if you've gotten the vaccine or you know someone who's gotten the vaccine, there still is a 5% portion of that population who will not get the antibodies. It's only 95% effective, which is actually a huge rate of effectiveness and much better than most vaccines, but there's still that 5% portion of the people who get the vaccine who will not, who is still, could potentially become infected. So that's important. We have a little extra time today for questions. We'll go for one more quick round. If you have another question, talk Erie. Joel.
I'm going to pass. Thank you, ma'am.
Sure. Jet TV.
Yeah, somebody called our newsroom today. It was a lady. She said she got a letter in the mail from Allegheny Health Network saying that they had her shot ready and they asked for her credit card number, and she hung up on them. And then she called the hospital, and the hospital said that obviously wasn't them, and there are scams going on. Have you heard of any other things like this, scams, people looking for others' information?
I have not, but I'm glad that you brought that forward for the listeners and viewers today, because it is really important that people know that no one should be calling you and asking you for credit card information if you are signed up for a vaccine. There have been questions as to why people are being asked for their insurance since the vaccine itself is free, but the cost of the administration of that vaccine could be charged to your insurance company. But again, you should not be asked for a credit card, and that should only happen at the point of vaccine, not any time before that. So please be cautious. I'm sure anytime something like this goes forward, scammers think that they can find a way to make money illegally and try to go after other people's funds who are maybe naive about this. So please be cautious, anyone who calls your house. And I personally never give a credit card number to anyone who's ever called my house. I only give it if I know who I'm calling and I'm sure who's on the other line. So never give your credit card number out to someone who contacts you directly. Erie Times News, David, do you have any final question?
Yes, one for Shar, or for you, Kathy. Numbers were up a little bit today. Do we read much into that? I mean, it's 121 cases. We've been in the 90s. Is there anything to think that we're starting to see a little bit of a rebound, or are we still trending in the right direction?
I'll ask Shar to address that.
Sure. We're still in the general ballpark that we have been. People need to get tested still. I know there's a lot of vaccine talk, but vaccine is going to be a while before it gives us any kind of significant community protection. So it is still extremely important that people continue to get tested when they have COVID symptoms. Remember, some of the symptoms can be very mild. Even with those very mild symptoms, it's still important for people to get tested.
Thank you. I would remind people, if you don't know where to go get tested, you could go to eriecountypa.gov. There is a link there with all of the places in Erie County that have testing available. If you go to one of the 3 neighborhood centers, Martin Luther King, Booker T. Washington, or Quality of Life, you do not need to have a doctor's order, and you can go there. All of the times, the numbers, the locations of those 3 facilities, plus many others across the county, are listed on that website. So I encourage you to go there. And lastly, we'll see if Erie News Now has any final question.
One final one for Dr. Snow. Doctor, in your professional opinion, are we closer to the end of this than we are to the beginning, and why or why not?
That is an excellent question. I'm sorry to report that I do not think we are closer to the end, because we have seen this rise. In the rise, we are still in. So it takes everything we have been doing, everything we're going to do to turn this around. And I think 2021 is still going to be dominated by COVID. And the sooner we have a unified approach using everything we have, the hand washing, the masks, the distancing, the staying away from groups, getting vaccine willingness, we can make a difference and turn this around. But I really don't think we can say we're on the downside yet, not when we're trending in the triple figures just locally.
Thank you, Dr. Snow, and I would reiterate that. I mean, yes, we'd like to see numbers down below 100. We'd like to see numbers in the low 100s because we got so used to numbers in the 200s, which were very frightening. But remember, it was just a few short months ago, September, October, that our numbers were down in the low double digits. So we are certainly a long way above where we were just a few months ago. And to Dr. Snow's point, when we come together as a community and do all these mitigation efforts collectively, that is how we're going to defeat this virus. So I ask everyone to do your part. I want to repeat the number that I said earlier for anyone who needs more information about the vaccine and doesn't have access to the internet particularly. It's 877-724-3258. 877-724-3258. And I want to just mention a star business, Donato's Pizza. They have 2 locations now on West 8th Street and East 38th Street. And they were one of the businesses who received one of the $5,000 COVID emergency business grants. And I found out this week that they used $3,600 of that funding to give each one of their employees $100 and to help them, pay their bills. So I want to commend them on taking that funding, and then the rest they said they used for rent. So thank you for giving directly to your employees, helping out, our citizens in this community, your employees, to get through this very difficult time. As always, I want to thank all of our businesses who continue to do their part. I have to tell you, mask wearing seems to be more and more common and done correctly too, over the nose as well as the mouth. So I want to thank our citizens and everyone who's doing their part. As Dr. Snow said, we got to do this collectively. And I also want to mention to you that tomorrow I am going to be having my State of the County address at 1 p.m. And if anyone listening or viewing today has questions about the state of Erie County, you can submit a question to me at the State of the County page at eriecountypa.gov by 5 p.m. today. So you have just a little over an hour to submit a question, and I will try to address your questions tomorrow. So as always, I ask all of you to do what you can to defeat this virus, to stay as close as home as you can, to always wear your mask, to stay out of crowds, wash your hands frequently, and please stay safe and calm. Thank you.
Once again, you've been watching today's update on COVID-19 from County Executive Kathy Dahl-Kemper. Let's take a look at the numbers today. Again, we had 121 positive cases reported today in the county. We also had no new reported deaths. The total of deaths now stands at 365 since March of last year. County executive saying most of those deaths have occurred in the months of December and January. We've also, as you can see, the total number of positive cases, 15,106 now. Crawford County reporting 37 new cases, Warren County 11, Chautauqua County, New York 108 new cases. Ashtabula County has not yet reported their numbers for today. The Commonwealth today reporting 5,874 new cases. The statewide total now more than 818,000. There were also 222 deaths reported in the Commonwealth, bringing that total since March of last year to 21,105. And as the county executive just said, she's asking everyone to continue. Stay home if you can. Wash your hands often, practice social distancing, and most of all, wear a mask if you do leave your house or if you're anywhere public. And make sure you wear it correctly. We'll have a complete wrap-up tonight on Jet 24 beginning at 5 o'clock. And that is it for us today. Thank you so much for joining us. Have a good afternoon.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to yourerie.com. We now return you to your regularly scheduled programming.